Now, the Nigerian Medical Association says the government must ensure transparency in the distribution of COVID-19 vaccines. Nigeria is expecting 100,000 doses of Pfizer-BioNTech coronavirus vaccine before the end of this month. The National Primary Healthcare Development Agency released the sharing formula for 100,000 doses of the Pfizer-BioNTech vaccine. According to the data shared by NPHCDA, the distribution breakdown is as follows: Kano 3,557, Lagos 3,131, Katsina 2,361, Kaduna 2,074, Bauchi 1,900, Oyo 1,848, Rivers 1,766, Jigawa 1,712, Niger 1,558, Ogun 1,473, Sokoto 1,468, Benue 1,423, Borno 1,416, Anambra 1,379, Kebbi 1,268, Zamfara 1,336, Delta 1,306, Imo 1,267, Ondo 1,228, and Akwa Ibom 1,161. Others are Adamawa at 1,129, Edo 1,104, Plateau 1,089, Enugu 1,088, Osun 1,032, Kogi 1,030, Cross River 1,023, Abia 955, Gombe 908, Yobe 842, Ekiti 830, Taraba 830 as well, Kwara 815, Ebonyi 747, Bayelsa 589, and the Federal Capital Territory at 695, and Nasarawa at 661. Now let's deepen this conversation as Professor Usman Yusuf, former Executive Secretary, National Health Insurance Scheme, joins us now. Professor, let's start from here. Lagos is the epicenter of the coronavirus pandemic. Some wonder why the state is not getting more vaccines. Could you help us with that?
Right. I think NCDC will be able to answer that question. But let me correct a misnomer. Lagos is not the epicenter. Lagos is where you see more because Lagos is where more is tested. Simple. So the primary problem we have is testing. And WHO said, testing.
Sorry, sir. May I just come in on that?
Because you're...
Even without that rationale playing out, surely it stands to reason that because Lagos is so densely populated, even if you tested elsewhere, you're more likely to get more cases in Lagos, as plays out in other cities like Johannesburg and New York.
Good. The case I'm making, yes, as we see the figures, there are more cases reported from Lagos than anywhere else. But Kano is equally as dense. But the testing in Kano is not as robust as that in Lagos. The general point I'm making is that we have issues with testing. So yes, you will have 10 times more than you have in Lagos if you test more. The issue is testing. We need to do more. Yeah, we are seeing more cases in Lagos because we are testing more in Lagos. If we are as aggressive in testing in Kano, Kaduna, Port Harcourt, Benin, we will see a lot more. So yes, COVID-19 is real, and our authorities should test. Only if you test will you be able to identify, isolate, treat if you need to, and do contact tracing. So yes, there's more in Lagos, and 1,000 coming from Lagos, I'll tell you, there are 10 times more than what we see. So there's a lot more than meets the eye.
Yeah, indeed.
Our call is authorities should do more testing.
Yeah, so yes. I think both you and I can answer the same thing in different ways. I mean, you can only deal with what you can see, and that's, I guess, is what they are dealing with. The question of testing cannot be taken for granted. But, Prof, what do you make of the distribution breakdown among the states, I mean, of the vaccine that we're expecting, BioNTech, Pfizer-BioNTech? What do you make of the distribution breakdown?
To be honest, I don't have information about the distribution breakdown. Educate me a little bit.
Oh, well,
Indeed.
The states are actually saying that, for example, Lagos and Oyo, they're planning to purchase more vaccines, so they're faulting the allocation from the federal government. Actually, Oyo State is saying they're going to bring in more vaccines from the allocation. They're going to get 1,800, which is 1,800. And if you're going to vaccinate twice for each person, that boils down to just about 900 people being vaccinated. And so it's not enough. And so they're making arrangements, according to them, to get more vaccines into the country on their own. The states are doing this. So I'm asking, how does this pan out?
Yeah. So where is Oyo State government going to get this vaccine?
It's
a limited supply all over the world. Yeah. So it's a limited supply all over the world. If anybody tells you he will go into the open market and get vaccines, he doesn't know what he's talking about. So COVAX, federal government of Nigeria and many middle and low income countries are hoping and aiming to have access to vaccine through the World Health Organization program called COVAX. This program intends to distribute about 1 billion vaccines to 92 countries that are low and middle income in 2020. So the issue of vaccine, the rate limiting steps are affordability, accessibility, acceptance of the people, and of course the logistics. So for a state to say, oh, I'm going to buy a vaccine from somewhere, they don't know what they're talking about. You don't go to the shelf and just buy vaccines. These are in limited supplies. Countries that are very rich are overstocking. Is the WHO, United Nations, and other bodies are making a case for middle and low income countries and say we should not forget them, because one case of COVID in the world makes the whole world unsafe. Okay. So it is in the interest of all countries, rich and poor, to have this virus out of our way.
Okay.
So no state can go to the market and buy a vaccine. I don't know what they are talking about.
Yeah. Might I suggest that this could be a symptom of the twin, if you like, fulcrum on which a lot of our executive issues swing. So the issues of trust and transparency. How do you feel these will play out in terms of even the vaccine distribution we're talking about?
Good. It's a very good question, Ekene. I have written severally, even at the onset of this pandemic, in Kano and many other states, when the governors were in denial phase and people were dying. Trust is key. Without trust of authorities anywhere in the world, no matter how wealthy a nation is, you will not be able to have a handle on this disease. We saw that in the United States. The poor governance exhibited by the outgoing government is responsible largely for what we're seeing. And we saw that in Brazil, where the president was a COVID denier too. And this virus is exacting a heavy toll on their people. So trust of the people, especially now, in this country, a lot of places all over the country, many people do not believe this COVID-19 is real. I can tell you for sure, I've lost a lot of very dear friends to this virus. So it is real. And the only way we can get this virus out of and prevent our people is all over the world, is the vaccine. But before the vaccine comes, we have very cheap ways of doing things. Social distancing, washing your hands, and masking up. These are the things that will prevent us. And trust in government is very, very important, especially as we get to the vaccine phase. That is why you see all over the world, you see kings and royals and presidents, even incoming President Biden got the shot in public. All over the world, the leaders are getting the shot in public to tell their people that this is safe if I'm able to take it. My plea to all Nigerians is that COVID-19 is real, and our only way out of this is vaccination. When the time comes for us to get the vaccine, I pray and hope every Nigerian, especially our vulnerable, our elderly, those those of ours that are sick, and our frontline workers, the doctors and the nurses.
I was going to come to that, Prof. The fact of the federal government says it's expecting 100 doses of the vaccine of Pfizer, BioNTech. This is like a drop of pee in the ocean. And then what about, you know, the balancing, the shortfall? How do they get it, one? And then the plan of how to administer this, who comes first, who comes second, so on and so forth.
Yeah, you see, all over the world, you have to ration. Ration in the sense that many of our young people that get the virus, they get over it and they don't get sick. But they make others that are vulnerable sick. So once you have something that is in limited supply, like the vaccine, you have to target who your populations you should give first. First of all, our vulnerable population, our aged, people that have diseases like diabetes, people that have asthma, people that have hypertension, people that are sick and can safely take the vaccine and are the targets of this virus. But most importantly, frontline workers.
Yeah.
Doctors and nurses and hospital workers are the ones that come in contact with this deadly disease and kills them. We have lost a lot of doctors. I have lost a lot of dear friends that are physicians, excellent physicians, the best among us to this virus.
Okay, so
we need to protect them for them to be able to take care of our people. So the science and the rationale behind how these vaccines will be allocated will be based on science, I hope. And that's what I'm seeing from the PTF.
Okay.
Okay. Where do we go when we observe that the President of the Senate is already expressing a strong lack of confidence, if you like, in the plan, both the vaccine acquisition and the rollout plan? He also mentioned that it would take 400 billion naira to vaccinate 70% of our population. And then on the back of that, you have governors like the governor in Bayelsa State saying that this money ought not even to be spent in this direction and that we have, as a nation, other priorities. So where do we go from here in carrying everyone along?
Right, good. You see, this discussion we're having between us, you and I and Indy, is not for us alone. It's for the whole world to see. We are having a discussion as to the rationale and the importance of this disease to Nigeria. And how do we balance our resources to funding this disease? I mean, it's not, nobody doubts it that we have more acute problems medically and socially than COVID-19. But here we are with an existential threat like COVID-19 that kills immediately. If we have the resources to buy the vaccine, to vaccinate our people, to prevent the spread of this disease, and nobody can doubt that's the route to go. And there are different types of vaccines, and there are costings. This is public, and you can do the costing. And I did that in my paper recently. And see, the cheapest will be cheapest, effective. The government is looking for a vaccine that is effective, that is relatively cheap, that will be able to store in a simple refrigerator that will be able to take all over the country. This will be the ideal. Not vaccines that you have to store in ultra deep freezer or the others. So I hope there is a rationale, and I think there is a rationale behind how the PTF and the government is deciding which vaccine to buy, how much to buy, and how to allocate them. And I think they need to be coming and talking to Nigerians to allay all these concerns. Many of these concerns are real for people. But it's for us and you to educate people and tell them this is the way we need to go. But I support 100% vaccination of our people, especially our vulnerable and people in the front line.
Yeah, Prof, we're going to get back to you. We'll keep you on post now. When we'll get back, we'll probably look at, you talked about efficacy. There's something on that, and the fact that my colleague here talked about the Senate President talking about his being a doubting Thomas. We'll get back after this break. Stay with us. I was still with Prof Usman Yusuf, former NHS Executive Secretary. Glad to know you're still there, Professor. The Senate President, discussing with the Health Minister, said he wasn't satisfied with the plans that the Minister is proffering So he said he's a dousing Ahmed. And then the Deputy Senate President said, I'm also a dousing Omar Agege. He particularly talked about getting this thing to the south, that they're only talking about the temperature level at which this vaccine can be kept, that they're only about 4. So how can the minister assure them that if you're getting this to the south, it will reduce in its efficacy and therefore give the people down here a fake or substandard vaccine? How will the minister, how do we get around this?
Yeah. So the doubting Ahmed and the doubting Omogege is their responsibility as our leaders, elected leaders in the Senate, to do the oversight. And yes, if they have any concerns, it's their duty to voice those concerns. And the main concerns are not the efficacy of the vaccines themselves, but the logistics. Remember, I told you there are about 3-4 vaccines on the market now. The AstraZeneca can be stored in refrigerator.
Yeah.
The Moderna from America can be stored in the freezer. And the Pfizer-BioNTech requires ultra-freezing, -70. So even in Germany recently, they had to dispose of a huge batch of their supply because it was spoiled because of the storage. So these are real concerns, and the Minister of Health and the PTF, I'm sure, will listen to these concerns and make sure they do what is right for our people. They are not going to spend people's money, billions of naira, to bring vaccines that will spoil along the logistics line. So cold storage, the storage of vaccines is critical. All nations in the world now, this is the biggest vaccination endeavors they are embarking on. And it's not easy. So they are real concerns, and I'm sure the Minister of Health, the PTF, the primary health care that's responsible for vaccination will go and take care of these logistics problems and concerns of our elected representatives. But yes, they are concerns that are real and need to be addressed, and they will be addressed, I'm sure, because this is too important to be blasé about.
Okay, as someone who has concerned himself in the past, and I'm sure still concerns himself with equitable access to healthcare, I'm referring to your background with the National Health Insurance. What aspects of this vaccine distribution play towards that? Again, people have mentioned that Africa seems to be inequitably disadvantaged when it comes to access to vaccines. But even when you come to Nigeria, you have the poor who are also in danger of that same disadvantage. People go to get tested and they find there's no access to testing. Those who can afford to pay 50,000 naira have access instantly. So what would reassure people that when it comes to vaccines, the rich won't again have that privilege over the poor?
Yeah, and that is a concern, and that's concern, and it's real concern. And the press and everybody in this country that can raise his voice and speak up need to continue to speak up and say, when these vaccines come, we don't want politicians cornering these vaccines for themselves and their relatives. They need to be distributed equitably and transparently. And you and I talking and writing, it's a way to keep the government on its toes. Equity. And I'm sure this president, that is his watchword. Equity. Adalci in Hausa. Equity, especially for those that do not have voices. We are not going to corner these vaccines in the big cities in this country, not giving it to those that need it and they don't have voices in places we cannot reach. We are their voices, and we need to continue to raise our voice for them. This is too important to play around with. It's not like fertilizer or these other things or palliatives that these politicians and these governors corner for themselves. This is very important, and it is God's work for everybody to be able to raise his voice and make sure those that need these vaccines get it, not because you are rich or you are in a position.
Yeah, Prof.
It's a real concern and will continue to be on the case of the government.
Yeah, before we let you
go ahead,
at a point in time, some parts of the country, some people refuse to accept polio vaccines, to get injection for it or get injected or inoculated, as it were. So what should government be doing to make sure that people, because in some quarters, people are talking about, will I take this vaccine? Won't I take it? Should I take it? The side effects and all that. So what should the government be doing to, aside the fact that people like the vice president, the president, and all these top government officials will take it in the open glare of the public to see that maybe there's no harm? What else should they be doing to get people to buy in and accept being inoculated?
Yeah. So it's a fantastic question, because in northern Nigeria, if the traditional rulers and the clerics had not come into this fight against polio vaccine, we would not have had any success. So it is very, very important for the traditional rulers and our clerics to be involved in this. But you cannot involve them until they themselves understand and are comfortable with this. How else can they go and explain to their people if they don't understand it, or they are not comfortable with it, or they have doubt? So the critical stakeholders in this country are not the politicians, if you ask me. They are our traditional rulers and our clerics, those that live with the people and people trust. So government should intensify reaching out to our traditional rulers and our clerics, make them understand, continue to engage them before they go out and sell this to the people. But what I will tell all Nigerians, I'm a physician. I've been a physician for 38, 39 years now. This disease is real. I have lost a lot of friends, many dear friends who are doctors. Vaccination is the only way out. If this vaccination comes, we will struggle and get it for those that are vulnerable, for those that need it, for those that are in the front line first, not politicians, not rich people. So fellow Nigerians, be patient. Accept this vaccine as something that is coming to help this world and eradicate this disease, rather than something that comes and harm our people. I thank you very much.
Thank you to